This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guests this morning are Dr. Krystal Atkinson, Chief Nursing Executive at Mon Health System. Good morning, Dr. Atkinson.
Good morning, Dave.
And we have Chad Callen, Chief Executive Officer, West Virginia Junior College. Chad, appreciate you taking some time, bud.
Thanks, Dave.
So, as we always do, we will get to know you two a little bit better before we jump into our subject today, and it sounds like something out of Star Trek, the Mobile Simulation Lab. I'm looking forward to getting into that topic, but Dr. Atkinson, we'll start with you. Just catch us up, your background, education. Tell us a little bit about yourself.
Absolutely. So I'm a native of Richmond, Virginia. I graduated with my doctorate in nursing from Old Dominion University. And I had a great career in Virginia, spent some time in New Hampshire, had a wonderful opportunity to join the team here at Mon Health. And I'll tell you what, when I came to West Virginia and had the opportunity to meet folks here and tour, just really fell in love with the place. The people here are fantastic and so excited to be able to call West Virginia home now.
All right, Chad, same to you. A little bit about yourself, bud.
I did obtain my license as a certified public accountant after graduation, but no longer practice publicly. And what brought me to West Virginia Junior College is it's actually a family affair. West Virginia Junior College is over 100 years old, but 60 of those years has been operated by 3 generations of the same family. And it's been a pleasure to serve the communities across the state since then.
And Chad, we'll get into this a little bit later, but if you can briefly explain the relationship between West Virginia Junior College and Mon Health.
Yeah, well, it grows stronger each day. Our first collaboration was with the nursing education program, an 18-month hybrid online nursing program. We talked on your show nearly a year ago, and here we are today. On April 10th, we started 48 nursing students in that collaborative nursing program. Really excited about it. There's a great buzz in the community. But here coming up on the 11th, May 11th, we're going to be unveiling our collaborative mobile nursing lab, which we're really excited for the community to see.
And that's what we're here to talk about today. So what is this mobile simulation lab?
Yeah, well, at its core, it's essentially a simulation center on wheels. It has 2 simulated patient care rooms that contain high-fidelity adult, obstetric, and pediatric simulators. It has a control room in the center with 2 controller stations, advanced technology for recording and for reviewing student practice, and it even has its own internal cellular internet capabilities, and also exterior monitor for participants outside the vehicle that can participate with what's going on inside the vehicle.
So, Krystal, for nursing students, what is the benefit they get from this mobile simulation lab?
Well, you know, Dave, it's a fantastic opportunity for the students to be able to learn different situations while in a nice, safe environment where they can make mistakes, they can ask questions. Most importantly, continuing to do things over and over will build their confidence. It will also better their practice. So when they do come in the hospital and they do have that patient that has fill in the blank situation going on, they're going to be more confident. When they show confidence to their patients' anxiety goes down tremendously because they feel very comfortable that the person taking care of them is confident in the care that they're providing. So it's a fantastic opportunity. I don't think that there are enough words to be able to describe the simulation center. It is far beyond things that I've seen. I wish, honestly, that I had this when I was in nursing school. I do think that not only for the nursing students, but it also has availability and application for experienced nurses.
Talking to Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System, Chad Callen, Chief Executive Officer with West Virginia Junior College. And Chad, what's the benefit here to having a mobile simulation lab versus having a brick and mortar building somewhere where you would just the lab would be permanently? Why mobile? Why is that an advantage in this situation?
Yeah, in short, it is that it really opens access to learners. You see, this equipment is very sophisticated and also very expensive. So it would be cost prohibitive to make this investment several times in several physical locations. But by making the technology mobile, we're able to open access to learners at multiple locations that both are rural and non-rural locations. In fact, that was its first intent, was to augment our rural hybrid online program where this type of technology did not exist. And so now we're able to bring this experience to even the most disadvantaged locations in West Virginia. So opening up access is really the key benefit.
And Krystal, for these nursing students, if you can give me an average day in the lab, what will they be introduced to? What kind of things will they be able to perfect in the simulation lab?
Oh, everything from what we think as basics of taking vital signs. So that's like going to the doctor's office and, you have somebody that's checking your blood pressure, right? To looking at monitors and understanding differences in heart rate and understanding when I look at that monitor and I look at my patient, this is what it means for my patient. Having the ability to sense that something is not right and I need to get help. So going through different disease processes, going through, as Chad said, it's not just the adult, there's pediatric, there is a mother baby. So having that ability to have an understanding of, okay, we're going to go through labor with this patient and we're going to go through complications, so it is a great opportunity to be able to look at different scenarios and have an understanding of, okay, if this were the scenario with my patient, how would I respond?
Talking to Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System, Chad Callen, Chief Executive Officer with West Virginia Junior College. Got to step aside, take a break. We'll continue our conversation after this. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning, Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System, Chad Callen, Chief Executive Officer, West Virginia Junior College. Krystal, Hospital and Nurses Week are being celebrated this week, so congratulations or Happy Nurses Week. I don't, how do you celebrate that? Is there cake involved at all, Krystal?
Oh, there's always cake days. There's certainly always cake. Every year we try to look at what we've done in the past I'm not going to give out too much of what we've been doing with our teams, but just really having different themes of just having fun, really just celebrating the fantastic nurses that we have. And from a hospital week perspective, everyone that participates in the care of our patients. So we have lots of celebrations going on this week. We're extremely excited to be able to honor the great people that work here every day.
Been talking about the mobile simulation lab. Will that be part of the festivities this week?
Absolutely. We're going to end our week with certainly unveiling it to our staff. We've talked a lot, and conceptually we've shared what it looks like, what we're going to be doing. But I think when they have the opportunity to be able to go inside and they can see, the different simulations that can be done, and have the ability to understand that, when we start to do our competencies and we do different training, that they have access to that, I think is going to generate a lot of excitement with our teams.
Krystal, Chad brought up the Mon Scholars program a little bit earlier, and I said we would get back to that, get into some more detail. So how will that affect West Virginia Junior College School of Nursing at Mon Health students?
Oh, absolutely. We've got again, great partnership here. And so anything that we can do to excuse me, lessen the burden for our students, that's exactly what we want to do. So again, through the simulation, we're making things readily available. Through the scholarship, we're easing that burden from a tuition perspective. So whether it's tuition, books, etc. And then one of the things that we think is most important, we take away that challenge of, oh my goodness, now I have to look for a job. As a Mon Scholar, they already have the opportunity to have a position in any one of our Mon Health facilities. I
kind of glossed over the Mon Scholar program there because we've talked about it a number of times, but remind folks what the Mon Scholar program is.
So Mon Scholar program is a scholarship program that we have with nursing schools to be able to partner, look at the opportunity to provide financial support for the student in the way of books, tuition, fees, some of that money up front that can be a stigma for people to say, well, I want to do this, but I can't do this right now. We're helping to be able to put that to the side for them and help make that again, just one more burden to be able to take out of the way for them to be able to enter into nursing school.
Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System. Chad Callen, Chief Executive Officer, West Virginia Junior College. And Chad, let me bring you back into the conversation. Can you give us kind of an overview of how the nursing program works at West Virginia Junior College?
Yeah, I'd be happy to. So the program is hybrid online, which basically means that everything that can be online is online and the things that need to be hands-on are hands-on. So the theory classwork students can do from the comfort of their own home or anywhere they can access the internet. But their lab experiences, which are traditionally held in a school environment, are going to be held at Mon Health in either their facility or on our collaborative mobile nursing lab, which will be parked on their property. The clinical experiences will also be held at Mon Health, unless there happens to be a specialty that's not offered at Mon Health. And then additionally, we're going to be augmenting clinical faculty. So where we can use Mon Health RNs, we're going to. And this will help to overcome the nursing faculty shortage. There's also a nursing faculty, or in addition to the nursing shortage, there's a nursing educator shortage. So this helps alleviate that burden. And then from the Mon side, it helps assimilate nursing students into their system and culture more effectively.
And Krystal, ever since this program rolled out, it was very obvious, at least I thought it was very obvious, that this was a mutually beneficial program for I guess, three ways: for the students, for West Virginia Junior College, and for Mon Health to get students the training they need, but also give them a pipeline to a job. So when you finish up, you're not going, okay, now I have to go apply to jobs. There's a pipeline and a light at that end of the tunnel.
Absolutely. And I think just looking at this system that we have set up, it just makes it a whole lot easier. I mean, so when we think about that nursing student that's finishing up school, the first thing that they're thinking about is, I got to pass my boards. Okay, great. I passed my boards. Now I got to find a job. We've taken all of that out of the picture. We're trying to make the education process as easy as possible. And then through the partnership, we've already worked with the students to be able to say, hey, you choose where you live and work. We've got Mon Health System that we have a Mon Health facility that will have a job for you.
Chad, when does the program start? How long does it last?
So we actually started our first cohort on April 10th of this year. It was amazingly excited. We had great interest in the program, wait list. It was awesome. And the program is just 18 months. So the students that started in April will graduate in November of 2024.
And November 2024, they're on the job and training continues there. Is that the idea?
That's the idea.
I kind of like the sound of that, Chad, as a way, both as a way to train students, but you're not looking at 4 years and additional cost. You get the training you need, and you get additional training, but you get that with the people and the patients you're going to be working with. This is, I don't know if it's outside the box, but it's a different way of looking at things, certainly, isn't it?
Yeah, absolutely. And the path towards a bachelor's degree in nursing is not out of reach either. I mean, we're starting actually our first a bachelor's program, an RN to BSN program in September of this year. So after you graduate with your associate's degree and you're working as a nurse at Mon Health, if you want to continue online at the same time towards your bachelor's degree, there's a pathway for that as well. So just new paths, to the same credential.
Talking to Chad Callen, Chief Executive Officer, West Virginia Junior College, Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System. I guess, Chad, where can people find more information about this program and possibly enroll? How do they get involved?
Yeah, they can call 877-25-online or simply visit our website, wvjc.edu, and visit the page for the School of Nursing at Mon Health and request more information.
Got to take our final break. We'll be back to wrap things up with Chad Callen, Chief Executive Officer, West Virginia Junior College, Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Just a couple of minutes left with Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System, Chad Callen, Chief Executive Officer, West Virginia Junior College. Krystal, why would a student consider nursing as a profession? Why should they consider it as a profession?
Well, definitely I think that it's a calling. I do think that we have had folks that are second career nurses that they just felt like it was just the right thing to do. They felt the need that they wanted to be able to take care of someone else. I don't think that there's a better thing to do than to be able to share compassionate care with somebody else that's in need. And I think that we see that each and every day in the people that take care of our patients.
Chad, I'm going to ask you to do this in about 30 seconds. Why should someone consider West Virginia Junior College's program?
Yeah, so I think that if you're someone that is an adult student and you're looking for a pathway that's flexible and can work for you, then we're a great option. Non-traditional methods serve non-traditional students. And we also have a high emphasis on providing excellent service to our students, not just excellent education. And so that's part of our culture, and we welcome anyone who wants to come and visit us.
You can go to the website, wvjc.edu. Dr. Krystal Atkinson, Chief Nursing Executive, Mon Health System. Chad Callen, Chief Executive Officer, West Virginia Junior College. Guys, thanks so much for the time this morning. I appreciate it.
Thank you, Dave.
Thank you.